My name is David Short. I'm an ear, nose, and throat doctor in Logansport, Indiana. The reason I became a physician, especially an ear, nose, and throat doctor, is when I was a child, I had a lot of problems with my ears and my nose and the throat. Many surgeries, both for the ears and the throat. I kind of got used to going to those doctors and got very familiar with them, got very friendly with them, so I wanted to pursue that career myself. What makes me a good doctor is putting my patients first, and I know you probably hear that all the time. So when I do talk to a patient, I tell them, my job is to get you better. My job is to fix the problem that you've got. But the philosophy is to treat them properly, just like you would want to be treated. So if you go to the Bible and says, do unto others as you would have them do unto you, we try to do that philosophy. Before I do surgery, I pray with my patients. I'll ask them, do you mind if we say a prayer? And we'll pray together. And I would say 90% of my patients I say, yes, let's pray together. And a lot of them will thank me for that. That eased my, especially the family, that eased my concern, my anxiety, that calmness that you gave me by that prayer. As a specialist, I get referrals from other physicians. And they usually tell me, you need to go see the ear, nose, and throat doctor because you have a problem, and it might be surgical. And they come in with that fear already that we're going to go to surgery. The majority of the patients will not need surgery. Most of the time, we find a small problem that can be fixed either in the office or with a very small office-based procedure or some medication for that problem. I think that the most rewarding part of our job is our children. Our children come in with bad diseases sometimes in their noses or ears, or they can't hear, or they're falling back in school. They learn the majority of what they're going to learn in the first 4 to 5 years of their school age. And if they're behind from hearing or not being awake, sleep apnea, patients that have large tonsils, that affects how they're going to learn later on. And we do a little ear procedure, and all of a sudden they recover that hearing, and all of a sudden their grades come up, or they're doing better in school, and their parents are no longer worried. Those are great results. Yes, our cancer patients are great because you can save sometimes their lives. That's a great reward for us as well.